Hello everyone, for this range of motion assessment, we are going to be doing the modified Thomas test, specifically with an extended knee. So we're going to be assessing the range of motion of the iliopsoas or the iliacus and the psoas major. The most common sporting action that we look at with range of motion of the iliopsoas is going to be sprinting. So we know that limits in range of motion or tightness of those two muscles is going to reciprocally inhibit the glutes in their ability to produce force, which is going to shift that force production onto the hamstrings, which is going to, of course, increase the risk of injury. So if we move on to the setup, we're going to have the athlete or patient sit on the edge of a bench or a table with the glutes hanging off the edge. This is going to ensure that our athletes with larger glute muscles are not restricted in their ability to move into full hip extension by the size of their muscle. From here, we're going to have the athlete hug both of their knees as close as they can to their chest without moving into posterior pelvic tilt. So we want to make sure that the upper portion of their glutes are still in contact with the table. Now we're going to have the athlete fully extend the leg that we're going to test. So they're going to contract their quads. From here, we're going to help them lower their leg as far as they can into full passive extension. At the same time, we're also ensuring that there is no abduction or abduction of the hip. This is going to take stress off of the iliopsoas and shift it more so towards the adductors. Once the end range of motion is hit, we are going to fully support their leg, and we're going to take our inclinometer and make sure that it's completely lined up with the femur, take the measurement, and record it down. Here we're going to move on to the other leg, so we're going to have them pull that left leg back up, fully extend the right knee. You can see here I'm cueing this athlete to extend the quad fully or extend the knee by contracting the quad. And again, we're going to repeat the same thing. You can see here I'm moving to the end of their foot so I can see that there is no external rotation of the femur. Once we get to the end range of motion, I'm going to fully support the leg, place the inclinometer along the line of the femur, make sure that it's level, take the measurement. Once we do 2 tests for each leg, we're going to take the average of the 2 measurements and compare it to literature.